So I've spent my whole life in healthcare IT. I started my first IT company when I was in college, literally in a dorm room in the US, and stayed in healthcare forever. I've had the privilege of working for 3 presidents, President Bush, President Obama, and our current president, working on healthcare for them. So how did I get involved with this? Coming from the insurance company side, the biggest question for me always is, how do I make sure that the right person is getting the right service for the right reason at the right time from the right person and at the right cost? And it all boils down to transparency and accountability. And that's why blockchain makes sense. Somebody earlier was asking me, why blockchain? Why not COBOL or Java or cloud? What's the technological reason why you're excited? And I'm not really excited about blockchain, really. I'm really excited by the fact that you have the ability to balance transparency and accountability. And that's really what is the promise of distributed ledger technology or blockchain or whatever the new acronym will be in a year. It'll probably be different. So what we decided to do was to attack the problem from the fundamental issues. How do I keep all the parties in sync? So care coordination or care delivery is complex. You know, we can talk about integrated delivery networks. So we can say, what if everybody just worked for us? Everybody just went to the same hospital. We had this mega hospital, and all the doctors, nurses, lab, pharmacy were all aligned. Imagine how complex that hospital would be. It would be no different than NHS. It would just be a mega care delivery organization with all the same coordination problems as you have today. So people think of utopia as a vertically integrated delivery network would solve all my issues, and it doesn't. It simply creates a microcosm of those issues, puts a thin layer of it on it, calls it a new label, and then you're expected that it'll automatically work. It doesn't. So no matter what your delivery model is, whether you are a single-payer country like UK or a multi-payer country like US or a direct pay model like India or a fully decentralized healthcare like China, you still have the same 3 issues. How do I get the care to the right person at the right quality for the right outcome? So that's care delivery. How do I make sure the care was delivered at the right cost? And how do I make it easy for the user to use the care? If you make the system so difficult they can't use it, doesn't matter how efficient it is. It's not going to serve the purpose. So those 3 objectives is what we are trying to solve in our platform. So let's talk about how do we see this working. So one fundamental notion of blockchain that we are trying to leverage is that there can be truly a centralized ledger of events, not of content, of events. Imagine a scenario, it's a very simple one, that you as a patient have a centralized ledger where everything that happened about you, regardless of the party who delivered that service or event for you, is in an event ledger, but no content. Not your clinical record, not your drugs, not your treatment, just the fact that you went to the doctor, you got a prescription, you went to the lab, you got a test result, you went to a specialist and you shared the test results with him, or you didn't share the results with him. You would have an immutable record of all events. Imagine now this ledger has access for certain people. And now you want someone like a miner to mine this ledger to see, is your care sequence the right sequence? Or is it even conforming with similar care sequences out there? So what we are talking about is using this event ledger to mine information and create proof of service, proof of quality, proof of outcome as computational scores that you can compare empirically between people. It's true that my genetics are different than many of you in the room. I'm predisposed to diabetes, you probably aren't. But that doesn't mean that my treatment in a chronic diabetic condition is going to be that different than somebody of a similar age and similar ethnicity living in the United States or in the Western world. So you can compare. We are very individualized, and health is very local and personal, but there are ways to aggregate and compare data. So our vision is 3 things. Coordinate care better through a shared event log, measure quality of care through a shared event log, and enforce accountability through a shared event log. But do not put sensitive data on it. Manage access to the data through a consent log that's part of your event log. We also have introduced an idea of a currency that understands consent and events in healthcare. So our vision is that fiat currencies are dumb. They don't understand why they're being transferred. They simply accept the transfer through ownership. When you pay somebody $1, it doesn't ask you the question, why are you paying me? Why am I going to this person's pocket? But an intelligent healthcare currency should. It should ask the question, What are you paying for? Are you paying the right amount? Are you paying the right person? Have you received the treatment? Have you gotten the outcome? What component of me should be fixed cost? What component of me should be quality care or performance-based? So we designed a currency, and this is really for you all to exploit as you see fit, a currency that has the ability to compute a proof of service score based on the public event ledger, the ability to reconcile and adjust automatically if you end up delivering poor quality of care and I end up being readmitted to the hospital 3 times. Perhaps there's an escrow element to quality of payment. There is the ability to manage consents so that you are only going to pay for things for which you have consented. There is the ability to replay entire chain of events that happened without actually sharing the private data around exactly how did you treat me or how did I get my benefits. And it can be programmable in the sense that you can program it for UK NHS model, which is single payer, or a US model, which is third-party payment model. Blockchain, when properly applied, does give us the ability to decentralize. Do I really need to own a system to adjudicate claims? Not really. I could have a farm of nodes compute the claim for me and give me a score and say, pay it, Pradeep. It's $35 claim. Your proof of service is 97%. Why are you going to waste time computing this? Send it out, make the payment. This is a $10,000 claim. Proof of service is 52%. Stop. Something doesn't add up. Services are too high. Price is too high. So I can decentralize my core systems. When you do that, I can spend more money on the call center to take care of the consumer calling in. I can pay better to the providers. I can eliminate my huge fixed costs. There's a huge implication when you redirect insurance dollars away from administrative to actual care delivery. My vision is that if we can achieve accountability through transparency and proper use of information that I control the usage of, then healthcare can be and will be transformed. And that's the vision that led me to leave my perch in a big building, in a big office, and start this company. And because I work for a 3-year-old whose care coordination is fiendishly difficult. Thank you, everyone.